Hello guys, so hope you are all okay. You're all enjoying your life. You're also watching my videos. You're also enjoying practicing ultrasonography. Welcome back to Dr. Arshad Nadeem Awan ultrasound teaching videos. Today my topic of discussion is ovarian vein thrombosis. Ovarian vein thrombosis is a very rare condition. It is also called as thrombophlebitis, ovarian vein thrombophlebitis, and usually seen in postpartum. After 3 to 5 days, it happens, and patient presented with the abdominal pain, abdominal discomfort, and fever. What actually happens in ovarian vein thrombosis? Ascending infections or infection spread from the endometrium to the ovarian vein, and ovarian vein get thrombosed. On the ultrasound imaging, you can appreciate ovarian vein thrombosis and also features of thrombophlebitis. But CT and MRI, the most confident modality, you can pick these information, these thrombophlebitis and ovarian vein thrombosis, quite confidently on CT and MRI. But to some extent, on the CT, on the ultrasonography, you can also pick some important informations regarding portal ovarian vein thrombosis. Ovarian vein thrombosis appears on the ultrasonography as a tubular structure adjacent to the uterus, anterior to the source muscle. It will appear as a tubular structure having low-level internal echoes of thrombus, echogenic thrombus within the lumen, which is normally elsewhere. You can find the thrombus. The appearance would be the same. Sometime you may be observed that abdominal aorta thrombus or some in DVT thrombus. The thrombus features are the same whenever it happens anywhere in any of the vessels. So for the ovarian veins are concerned, it will be similar to the other thrombus as well. Doppler play vital role, as you all know, that picking the thrombus and intraluminal thrombosis ultrasonography and Doppler ultrasound particularly is a very important and specific tool to pick to look for the blood flow. There will be either sluggish or maybe absent blood flow. If it is totally occluded, there will be absent flow, and if it is partially occluded, there will be sluggish flow. So these 2 points you can pick on the Doppler ultrasound imaging. How it will appear on the ultrasound imaging, how you will write the report, and how you will reach to the conclusion, and on the top of it, how the patient would be managed. So normally patient would be given anticoagulant, because ultimately the anticoagulant is a therapy which would likely dissolve the thrombus, and antibiotic therapy to remove the infection if it is around. Another important thing, as because of the PID, there is likely chance of getting the portal vein the ovarian vein thrombosis. So therefore, if there is PID and if there is endometrial infection, there is a likely chance of ovarian vein thrombosis and ovarian vein thrombophlebitis. So all these are the information you will pick on the these ultrasound imaging. So let's start watching these images and start to pick all these information and write a conclusive report. So let's start watching images.
This is a transvaginal image, and on this transvaginal image, clearly visible right-sided portal vein can be seen, and it is filled with internal echogenic material, which is actually thrombus. This is indicated by the white arrow. So look for the ovarian vein, and this ovarian vein is dilated and it is filled with echogenic thrombus. So if you put the Doppler signal on it, there would be no flow, because this thrombus is completely occluding the ovarian vein. So this is called as ovarian vein thrombosis. In other words, the another term we can also use for this image is thrombophlebitis. Whenever vein is filled with the thrombus, and if it is not deep vein, otherwise you will use the word deep vein thrombosis, but as these are the superficial vein and the smaller vein, so therefore the best word is a thrombophlebitis, because it would be associated with the surrounding inflammatory area. However, so far the treatment is concerned, because it is thrombus and it needs to have the anticoagulant therapy. So therefore you either mention the word ovarian vein thrombosis or thrombophlebitis. Either way, both would be applicable. This is the same patient, and another separate view has been shown, and the Doppler signal has also been shown to just visualize whether how much lumen of the ovarian vein is occluded. Here you can see to some extent there is sluggish and partial flow can be seen in the surrounding or in the peripheral part of the lumen. However, centrally it is occupied by the thrombosis, echogenic thrombosis. Again, this white arrow is indicating the thrombosis region. So ovarian vein is dilated, it is tortuously dilated, and it shows partial flow. Centrally it is blocked as this lumen is occupying, partially filling the ovarian vein lumen. This is echogenic thrombus. Wherever you see the thrombus, this is important to use the Doppler signals, because Doppler is the one important signal and what important modality to confirm whether there is any thrombosis, intravenous thrombosis or not. This is another two images has been shown that for the clear understanding how the ovarian vein or ovarian vein thrombosis will look like. This is the left ovary. Normally, as I mentioned in the earlier introduction section, that the right ovaries is involved in 90% of the case. Whenever there is left ovary involved, it is less it's mean very rare case, and you have to look for the other cause. So in that condition, you have to look for the generalized and systematic abnormalities as well. On the ultrasound imaging, what important features you can appreciate: the vein would be dilated, it would be filled with thrombus. And how will you confirm it? There are two methods. The one is compressibility method. With the probe compression, the veins normally, if it is normal and lumen is not occluded, it will be compressible. In case of thrombus, it will not be compressible. So just give a compression. If it is compressible, so it means that there is no intraluminal pathology or intraluminal thrombus. But if it is not compressing, this is an indirect sign there is something in the lumen of the vein, and this could be thrombus. Have a look and try to identify the intraluminal narrowing, intraluminal thrombosis, intimal thickening. So all these terms can be seen, all these features can be seen on this particular image. Sign of interrogation is showing that what it is. Actually, it is luminal narrowing, it is surrounding intimal thickening, and also thrombus formation. So this is what exactly the thrombus is. Now you have to use the two techniques as I mentioned earlier. Compress this vein with the pressure of transducer. If it is compressible, so it means it's normal, but in this case this would never be compressible. This would be a non-compressible vein because it is filled with the thrombus. And the second thing is, you have to put the Doppler signal on. There will be no Doppler flow if it is completely occupied or it is completely filled, so there will be no blood flow on the Doppler imaging at all. But if it is partially obstructed, as I mentioned earlier, and you have seen the previous image in which you can see that there was a partial flows in the surrounding of in the periphery of the thrombosis. So in that case that would be a partial, and but in this case this is a complete luminal thrombosis. For better understanding, a close view has been shown here on this slide, and also it has also given the measurement as well. So look for the diameter, look for the dilatation, and look for the proper length, to what extent this thrombus has occupied the ovarian vein. So this is again ovarian vein thrombosis, which is quite easy to pick on the ultrasound imaging. And beside this, as I mentioned, there are two techniques. The one is compression technique, and another is ultrasound Doppler signal. So these both techniques can easily confirm. And another point is, if there is proper preparation, sometime because of the bowel gases you may not be able to see that. But if you're doing and if you're performing transvaginal scan, on transvaginal scan these features can be easily picked. and the important is especially and look for the right ovarian vein, because right ovarian vein is almost involved in 90% of the cases. So therefore always focus on the right sided ovarian vein, and if you did find these features, so this would be definitely ovarian vein thrombosis. Just a quick example on the CT abdomen axial images. Here on these axial images you can appreciate all the structures left. Bowel loops are visible, and beside this, that arrow is indicating intraluminal thrombosis of the right sided ovarian vein. This ovarian vein is occluded by the thrombus, and beside this, enhancement of the surrounding wall can also be seen. So this is example of the ovarian vein on the CT images, because ultimately you will go for the CT images to rule out whether there is some problem or abnormality sitting somewhere in the abdominal cavity or in the upper abdominal region. So for that, CT is very important. So this CT image will show you that there is thrombosis, and it will appear like that. Always focus on the right side, and always look for the vicinity where the ovarian vein lies. So this is what the ovarian vein thrombosis on the CT axial images. Just to familiarize your eyes with the ovarian vein thrombosis on the CT scan axial images, here again this is another example of the ovarian vein thrombosis, which is indicated by the red arrow. This red arrow is indicating thrombus within the ovarian vein. Ovarian vein peripheral wall is enhanced, however intraluminal you cannot see any contrast. So this is a filling defect. So this filling defect can be seen on the CT axial image, and this is ovarian vein thrombosis. You might have noticed that whatever images have you seen, this was from the right ovarian vein, because right ovaries is 90% involved. One of the images was on the left ovarian thrombosis, which was because of some other systematic abnormalities. So this is a clear example of the ovarian vein thrombosis on the contrast enhanced CT axial images. Have a look for these two abdominal axial images of different level. So these both showing the same right ovarian vein thrombosis. So it will look like the way you can see and you can appreciate, especially contrast enhanced CT will work, and rest of the ovarian ovarian vein path would be contrast enhanced, but in case of thrombosis it will show the luminal defect, as you can appreciate. Beside this, the surrounding wall will be enhanced, and it will be easily to pick the ovarian vein thrombosis. So these two examples are also for your better understanding that how it will look like on the CT images and how you will appreciate ovarian vein thrombosis.
Yes, guys, this was all about the ovarian vein thrombosis and ovarian vein thrombophlebitis. You have seen already these images, and these images clearly depict that how the thrombus will look like in the ovarian veins, and how you will pick on the transabdominal and transvaginal. Particularly, transvaginal is the confident modality to pick the ovarian vein thrombosis and thrombophlebitis changes if there is inflammatory signs around the ovaries and around the ovarian vein as well. So hopefully this would be a very useful video for you. As I mentioned, this is very rare entity, and especially it would be seen in postpartum. In 3 to 5 days of postpartum it's likely to occur, but regardless of postpartum, there are some other predisposing factors, like in PID there is also a chance of portal vein thrombosis, or there is some coagulopathy or some other abnormalities related to platelets and related to fibrin abnormalities. So the ovarian vein may also be stuck with the thrombosis. So hopefully you would have get all the information which you required for the diagnosis of ovarian vein thrombosis. Keep watching my video with some other new informative videos. We'll see each other. Till then, take great care of yourself. See you then. Bye bye.